Good evening, everyone. This is Ann Cuppinger from the Managed Care Technical Assistance Center, and I'm here with a number of state partners who are very excited to talk to you this evening about the Children's Health and Behavioral Health System Transformation. We hope everyone's been able to sign on to the webinar and hear the audio. You'll see some information on your screen where you can contact the host if you are having any difficulties. We want to give you a little bit of an orientation to the WebEx system, which may be new to some people. We have muted everyone on the call because we have quite a few participants, but we really want to get your questions. And you'll notice that there is a chat box on the right-hand side of your screen. If you can't see the chat box, click on the little speech bubble that's at the bottom of your screen, and it should open up the chat box to the right. Once you've opened up the chat box, you'll see down near the bottom there is a place where you can type in a question, and you can chat that question to the host. There's actually a drop-down menu, and you can choose who you chat the question to. But if you chat it to the host, it will land in the right place, and folks here will be able to take a look at the questions. What we'll do is we'll do a presentation, a brief presentation, and then we'll have an opportunity to answer many of your questions. And so with that, I'll turn it over to Meredith Ray Labatt from the New York State Office of Mental Health.
Having a little bit of trouble with the mouse. We're going to see if we could find another battery, and the keyboard's not working. So we're going to start off with...
Caitlin, will you advance the slide, please, for us?
That might have to happen.
Yeah, I will do that.
Great. While we get a new battery. This is live and exciting. So, hi, folks. Thanks so much for joining us today. This webinar is specifically for individuals, youth and family members, or caregivers who want to learn more about the changes that are happening within the children's Medicaid service world. My name is Meredith Ray Labatt, and I'm with the New York State Office of Mental Health. And here with me today are a number of other people representing different New York State agencies who serve children, including the Department of Health, the Office of Children and Family Services, the Office of Alcoholism and Substance Abuse Services, and the Office of Persons with Developmental Disabilities. So we're all here today to talk to you about the changes that are happening within your children's system and help answer your questions. So we're going to go through all the information today on the slides, but we're going to leave time at the end of today's webinar to answer as many questions as we can. If we happen to take up the full time for the slides, we're going to stay after the scheduled time for a little bit to answer any questions that you may have. Questions, as was just stated, can be inputted into the system, into the chat feature, which is the little thought bubble at the bottom of the screen. If you have any questions about anything that we discussed today and you're interested in learning more, first and foremost, you all potentially may have a care manager that you're engaged with if your child is in the health home program or in one of the waivers. You can feel free to talk to your health home care manager or any of the care managers that you're working with. But in addition, if you have other questions that or want to learn how to access services, you can also call the number that's listed on the screen, the 1-800 number, or you can also email managedcarecomplaint@healthnewyork.gov. Although it says complaint, it of course will take complaints, but it will also answer any questions that you may have about the available services for you or about how you can access them for your child. So also, today's webinar is being recorded, and it also will be posted on the Department of Health's website. So if you would like to hear the presentation again, if you didn't catch everything that we've discussed, or you had so much fun that you'd like to share it with other people that you know, you can feel free to point them to the Department of Health's website, and this webinar will be recorded and posted there. Great, thank you. Throughout today's presentation, we are going to be referencing a number of different types of services, programs throughout the state. As with many things that happen in the state, we like to create acronyms, which are, we turned a string of words into letters to make it easier and quicker for us to say. So that's going to happen throughout today's presentation, but not to worry. On the presentation, we have a slide that will define each of the terms for you. So if you hear us say these things, this is what they mean. We'll say so during the presentation, but there's also this lovely handy-dandy one-stop glossary that will define each acronym for you for easy reference at a later time if you forget. Next slide. Oh, great, thank you. So as you can imagine and may have heard, New York State's Medicaid program for children is going through many new changes, including the creation of new services or the ability to get services that were not available before. We're going to review these changes and discuss how they may affect you and your child. We're also going to discuss the new services and how may they benefit your child and help you and how you can get them. Many families may already have heard about these changes from their care managers, but this webinar will give you an opportunity to learn more and to be able to ask questions. So we're going to go over a number of topics, including overviewing the changes, talking more about home and community-based waiver service programs, what's called Children and Family Treatment Support Services, which are new services and how you might be able to get them, Medicaid managed care, and going to also point you to a number of resources for additional information. Great, thank you. So just for history and background, many years ago, Governor Cuomo began an effort to find ways to increase the quality of Medicaid services, to help manage costs better, and to improve results for individuals who are receiving Medicaid services. To do this, he decided that we would move services that were kept out of managed care into Medicaid managed care. But before we did that, we wanted to make sure that the children's services were working in ways that would meet the needs of children and families. So we made some changes to the children's system to achieve that goal. So we did a number of things that we felt would really help children and families to be able to get more services or get them in better ways. These included taking 6 different children's waivers that had different individual services in them and combine them into one waiver so that children could get a wider array of services based on their individual needs. We moved services that we found to really work well for children and families, and we made them more readily accessible to all children with Medicaid. We also wanted to make services available to families at more convenient locations, such as your home or somewhere in your community, such as a school or library, instead of just offices. And we also wanted to make services more available to children at any age. So services will now be available to children under the age of 21, starting at the age of 0. So the services that we're talking about throughout today's presentation will really help to describe how we created services that will achieve all of the goals outlined on this slide: equal access, more services available, being available to you in your communities, and being available at a wider age range from 0 to 21. Throughout this process, we also wanted to make sure that all these changes would not affect the services that you are getting today, and that you would not lose any services that you might have now moving forward. So first, let's start talking about the changes that are happening to the children's home and community-based waiver. The changes that are occurring are specific to 6 different home and community-based waiver programs. Which ones are they? It includes the Office of Mental Health Serious Emotional Disturbance 1915C waiver, which is for children with serious emotional disturbance served by the Office of Mental Health. The Department of Health Care at Home 1 and 2 waiver, which is to serve children who are medically fragile. The Office of Persons with Developmental Disabilities Care at Home waiver for children who are also medically fragile but have a developmental disability. And 3 waivers with the Office of Children and Family Services. They're known as the Bridges to Health waivers. They serve children with serious emotional disturbance, with children with medically fragile needs, or children with developmental disabilities. These are the 6 waivers that are going to be changing and combining into one waiver. So what are some of the changes that are going to be happening to the waiver programs? Waiver care managers, sometimes called care managers or care coordinators, are now going to be called health home care managers under the health home program. In addition, New York State is closing these waivers but combining them into one new waiver called the Children's Waiver beginning April of this year, 2019. Children will not lose their eligibility for any of their waiver services they get today, and furthermore, your child may actually be eligible for new services with this change. So, some of these changes you may have already heard about from your care manager, but just in case, we'll go into further detail. All children who are in an HCBS waiver must have care management. As of January 2019, you might have heard and have now experienced the care management changing to transition to something called the health home program or health home care management. Most children going through this change have been able to keep their current care management provider. Your care manager should be explaining what this change means for you and your child. As you may know and have heard, health home care management is an optional service, which means that you can choose to participate in health home or choose not to participate in health home. But if your child is receiving home and community-based services, they must have care management, and if they do not choose health home, their care coordination will be provided by the Children and Youth Evaluation Service, which we'll talk more about later. So what is health home care management? A health home, as hopefully you know, is not actually a place, it's a person who can help you find services that are right for you and your family. It's a dedicated individual called a care manager that helps you get the services that you want and need. All children eligible for home and community-based services can get health home care management. They can also get health home care management if they have chronic health conditions or significant mental health concerns. The transition to health home care management should not disrupt any of the services that you're receiving today. As I mentioned earlier, all children who are receiving home and community-based services in a waiver must receive care coordination. If a child or family decides not to be in the health home program, they can receive care coordination from the Children and Youth Evaluation Service, what we call CS. CS will also conduct HCBS eligibility determinations, annual assessments, and plan of care development for children who are receiving care coordination from them. They will also assist families who do not have Medicaid but can get Medicaid due to HCBS eligibility. They'll assist families with their application process. Again, the transition to CS or receipt of CS services should not disrupt or impact the services that you're receiving today. So, how do you choose whether to get health home care management or CS care coordination? Health home care management is a comprehensive care management program that will assist families in a variety of ways. They can assist with determining HCBS eligibility, have a comprehensive plan of care which includes your medical, your dental, your behavioral, or mental health services all in one. They will refer and work with the family to connect you with providers for all the services on your plan of care. They'll have team meetings with your service providers, and they'll talk to your providers regularly about the care that you're receiving. CS, on the other hand, is only care coordination for HCBS services. So they might assist families with Medicaid eligibility, help determine HCBS eligibility, but they will only develop a plan of care which includes HCBS services. All other services that a child and family may need, such as medical, behavioral, or dental, will need to be coordinated by the family themselves. CES care coordination is for HCBS services only. Now, we've heard from families that there's been some confusion and questions in regards to whether or not their child who has a developmental disability is a part of this transition. So we wanted to provide some additional information about the different waivers under the Office of Persons with Developmental Disability to help you understand if your child is part of this transition or not. So you might have heard of something called Care Coordination Organization Health Home. This is for individuals who have intellectual or developmental disabilities and are receiving waiver services under the OPWDD Comprehensive Waiver. The Comprehensive Waiver has no age limit and is available to children and adults, and the care coordination under the Comprehensive Waiver is provided through Care Coordination Organization or basic HCBS plan support. On the other hand, children who have a developmental disability and are medically fragile and are part of the OPWDD Care at Home waiver are part of this transition and will be moving into the Children's Health Home program, which we discussed earlier. That's for children who are under the age of 21 only and have both developmental disability and are medically fragile. So the difference between the comprehensive waiver is that will not be part of this transition, but the Care at Home waiver for children who are intellectually or developmentally disabled and are medically fragile are part of this transition. So we're going to talk a little bit more about the waiver and the home and community-based services that are available within the waiver. Hopefully all of you know that the home and community-based services waiver is directed towards helping children and youth with complex health or mental health needs to help keep them in their home and community. They can be provided where children and families are, in their home and in their community. They help support children and youth as they work towards achieving their goals to be successful, to be maintained in their home, in their school, and their other community environments. They offer individual flexible services to meet the various health, mental health, or developmental needs of the children and youth. So who can get home and community-based services? Home and community-based services are for children and youth under the age of 21 who are enrolled in Medicaid. However, children without Medicaid may be eligible for home and community-based services and can be assessed for eligibility through the Children and Youth Evaluation Services we talked about earlier. These children are children who need extra care at home or in the community to help avoid the need for care in a long-term care facility or psychiatric inpatient hospital. Your care manager, your health home care manager, or CS, can do an assessment to see if your child is eligible. So the combined children's waiver for children includes children with significant medical needs that are medically fragile, children with serious behavioral health concerns, or children in foster care who are struggling to address their mental health, physical health, or developmental disabilities, similar to the 6 waivers that we described earlier today. So what are the available services as part of the home and community-based services? Some of these services might be familiar to you because they're already part of the waivers that your children are in today under one of the 6 waivers previously mentioned. But these services will now all be available to children and be able to be on plans of care based on the individual child's needs. So if by chance your child has multiple needs, for example, if they are medically fragile but also have significant mental health concerns, they are now able to receive a wider array of services on their plans of care to meet their individual needs. So, here are some examples of the services that are available under the waiver today. Community habilitation, which helps children and families learn daily living skills or social skills. Day habilitation, which does the same but in an agency setting. Caregiver family support services, which help caregivers and families get the training and education that they need to make choices about their child's care. Respite services, both planned, which is scheduled, or crisis, which is unexpected, is available for children to help provide short-term relief for families and caregivers or the youth to support the child's mental health or substance use or other health goals. Palliative care is available for children with chronic or life-threatening illnesses. There's a variety of different types of palliative interventions that are available to children and youth, including massage therapy, art, music, and play therapy, pain and symptom management, and bereavement counseling. All of these services are available to children with chronic, significant health concerns. Other services include community self-advocacy, training, and support. This helps children and their families get help to understand the various services that they may need, such as medical, mental health, or substance use. They can also help prevent any difficulties in taking part in community activities by helping to explain how the activities can help their child and how they can get them. Pre-vocational services are for children who are 14 and older to help them learn skills to get ready for paid work or volunteer work that they may be interested in. Supported employment is also for children 14 and older who are really ready for a job and can get help to stay in a job or to get a job with steady wages. Some additional services which are available to children within the waiver are environmental modifications, which would help a child or youth make changes to their home to help with their health needs. Vehicle modifications, which are changes to a vehicle to help with health needs, for example, a wheelchair lift or a ramp. Adaptive and assistive equipment, which are technology aids to help support a child and youth health and welfare. This can be a computer tablet that speaks for the child. And non-medical transportation, which can help provide transportation, if you don't have it, to services or activities that supports the goals outlined on the child's plan of care. Also, there are 3 additional services that will be available under the Home and Community-Based Services waiver, which were previously under other waivers that have been combined into the Children's Waiver. These services are only temporarily under the waiver and will soon move to what's called the state plan. They're known as Children and Family Treatment and Support Services, which we'll talk more about later, but they will be available under the waiver until they move under what's known as CFTSS, which again we'll talk about soon. But the services that are available to children in the waiver will be crisis intervention, when a child has increased emotional stress or a psychiatric need that keeps them from being safe in their home and community. A professional can come to their home or the community to help assess the child and connect them to needed emergency services. Youth peer support services and training. These are provided by a young person who also has lived experience within the children's system, who can help a young person set goals and develop their community living skills. Or family peer support services, wherein families can get support from a family peer person with lived experience with understanding social, emotional, medical, and the developmental needs that the child may have. Additionally, we provided some links for where you might find additional information about these services, or where you might be able to find providers who are designated and allowed to, are able to provide these services. Okay. Once again, as I mentioned earlier, there had been some confusion as to the differences between the OPWDD comprehensive waiver and what is now the new children's waiver, which the OPWDD Care at Home waiver is a part of. So once again, on the left-hand side is the combined array of services under the children's waiver, which is the combined 6 waivers that we talked about earlier, which includes the OPWDD Care at Home waiver for children who have a developmental disability who are medically fragile. And on the right-hand side is the OPWDD comprehensive waiver for children who have, or for children or adults who have developmental disabilities and qualify for these services under OPWDD. So you'll see there's a lot of overlap in the services, but they're different waivers. And so the one on the left is what's being impacted by the transition that we're talking about today. The one on the right, there are no changes happening. Okay. So as I mentioned, there are a number of services now being called Children and Family Treatment and Support Services, and we're going to go over them right now. Very exciting. Okay, so what are these things you're calling Children and Family Treatment Support Services, or CFTSS for short, because as I mentioned, we like to create acronyms for most things that have lots of words in them. These services are services that are available to children with Medicaid under the age of 21. So children starting from 0 up until the 20th birthday can receive these services. And these are for children or young people who are experiencing mental health or substance use needs. They can be provided at home or in the community outside of an office setting. They support families in a number of ways, including help them improve their health and well-being and quality of life. They meet the individual needs of children and their families by identifying needs early, supporting them in their home and community, and preventing the need for emergency room visits, hospital stays, or out-of-home placements. These services that are available, some of them began earlier this year in January of 2019. Some of these services might sound familiar or be similar to the services that you were receiving under the waiver or that you were transitioned to starting earlier this year, because they had previously been a part of the HCBS waiver, but are now part of the new CFTSS services. These services are known as other licensed practitioner services. These are treatment services for mental health and substance use needs by licensed professionals like a social worker or a mental health counselor or marriage and family therapist. Another service called Community Psychiatric Support and Treatment. This services that are provided to children and families supports and helps and intervenes with them in the home or at times of crisis, or to help identify strengths and natural supports. Psychosocial rehab are services that help build skills, social relationships, and activities that help to grow independence. We do have brochures and materials available on these services. They are available to you today if your child is not engaged with them, or you feel like they might be services that will help your child. Please feel free to ask your care manager. You can also ask a current service provider that you might be engaged in, whether it be clinic or day treatment or other services, and your child might be eligible and might benefit from these services. In addition, there are new services that are becoming Children and Family Treatment Support Services. You heard me speak of them earlier and mention them under the Home and Community-Based Services Waiver. These services will be available to children who are in the Home and Community-Based Services until the date noted on the slide. At that time, they will become Children and Family Treatment and Support Services, and they will be available to children who are not only in the HCBS waiver, but for children who have Medicaid, are under the age of 21, and who meet the medical need for the services. So, starting in April, these services will be a part of the combined children's waiver. And we went over what these services were earlier, so I'm not going to do that right now. And how do I access these services? So that's great. So to get CFTSS services, again, you can speak to one of your current service providers. As I mentioned, if you're engaged in a clinic, or if you're in receipt of other services, such as day treatment services or other substance use services, you can speak to your service provider about these new CFTS services, and see if you might be eligible. Speak to your health home care manager. You can also speak to someone, a school social worker or a counselor. You can also speak to somebody in the county, such as the Department of Mental Health or the single point of access, which is through the Department of Mental Health. They can help make a referral for you for services or a recommendation for services. In addition, I also want to say, most importantly, you can make a referral for services, you or your child. If you come in contact with a service provider who is a CFTSS designated provider, and you are interested in learning more about these services, and you can say, I think my child would benefit from these services or would need these services, you can speak to that agency, and they could do an assessment to determine if these services might be right for you. So you can self-refer as well. So we're going to talk a little bit about Medicaid managed care. As I mentioned earlier on, the changes to the children's Medicaid system all began because we were getting ready to move some services and some children into Medicaid managed care. This means that some services, and therefore the children getting them, will have to transition into a Medicaid managed care plan. So for children who are in the children's waiver, if they're not already enrolled in a managed care plan today, they will need to enroll in the near future. This is when the last of the services and the populations of children will be required to enroll in managed care, and eventually all children will have to choose a plan unless they are otherwise excluded from managed care. So, what is Medicaid managed care? They're managed care plans that are health insurance companies responsible for overseeing and coordinating the care that you receive. Today, most children are already enrolled in Medicaid managed care, but there are still some services, such as the HCBS waiver, that are not yet covered by their plan and covered in regular Medicaid. Some children must enroll in Medicaid managed care. Some children may enroll in Medicaid managed care, but do not have to, and some children cannot enroll in a Medicaid managed care plan, and their service will remain being paid through by regular Medicaid. You may also know this as fee-for-service Medicaid. Many children's services are moving into Medicaid managed care in the future, as I said, and there are no changes yet for children participating in the HCBS waivers. These children do not have to worry about picking a plan right now. However, most children are able to enroll in the Medicaid managed care plan if they would like. When it will be time to pick a plan, families will be getting a letter with instructions and will have 60 days to choose a plan. If you have any questions about enrolling in a plan at that time, you can speak with your care manager, or you can always call the New York Medicaid Choice number at 1-800-505-5678. And the TTY number is also listed here as well. A few other important reminders. The goal of this transition is also to make sure that children and families have the same services as they're getting today as they will tomorrow, and trying to make this transition have as little change to the child and family as possible. So we're hoping we expect that children and families will be able to keep the services that they're receiving with no loss. But if a child is found to have problems keeping his or her services during this transition, the family can contact their current care manager, also known as the Health Home Care Manager, or call the state's toll-free managed care helpline, again at 1-800-206-8125, or email managedcarecomplaint@healthnewyork.gov. We've listed a number of resources available that might assist you in any questions that you may have, including some educational and resource materials, information about health homes by county, a directory of Medicaid managed care organizations, the New York State Health Marketplace, and the New York State Provider and Health Plan Lookup link. Also a number of numbers which we've discussed earlier for the individual organizations that we talked about, and their numbers all on one sheet of paper. So right now, we're going to spend some time looking at your questions that you've submitted to the chat box, and we're going to answer your questions, as many questions as possible over the remainder of today's presentation.
Great, so we'll be right back. We're just going to organize some of those questions, so hang on the line and we'll be right back with you.
So, good evening, everyone. This is Colette Pullen with the Department of Health, and I have a couple questions here. So the first question, which is really simple for me, is where do we find a list of agencies and providers that provide that service? So we will definitely add that link to our slides.
I believe it was in it.
I think it was.
Yeah, it's in
under HCBS.
Right there.
I went too far. It's right.
There we go. So all the providers for the children and family treatment and support services and the home and community-based services are designated by the state, and so the link is there. I wasn't really sure. And I believe the providers are listed, and you can see them within your county and by the services that they're designated to provide. So that would be the best way. Again, your care manager or your managed care plan or other folks can assist you if you don't have a computer or access to that information to get you that information. There's also a question that what if a child needs to enter in at 18 or 19 years old, can they still access children's services? So if you're asking about the children's waiver, the home and community-based services waiver, or the CFTSS, Children and Family and Treatment Support Services, I'm trying not to use the acronym, so that goes up to the age of 21, so they absolutely could access those services. For children who turn 18 and who may have a developmental disability, they would be able to access OPWDD. As Meredith mentioned, there is no age limit. So it really depends on the needs of your child. We also, at the age of 17, 18, start to work with children and families to talk to them about the adult system to make a transition to that adult system. So once again, I think it really depends on your needs of your child, diagnoses and other things, where the right fit may be, but they could absolutely access children waiver and services up until the age of 21.
There's a question here that says, will you be covering changes to Article 31 clinic-based services? This transition shouldn't impact the changes to Article 31 clinic-based services. The only changes that are occurring in regards to Article 31 clinics is the transition to managed care for SED designated specialty clinics. So if you have any further questions in regards to that, please feel free to reach out to the Office of Mental Health, and we'll be happy to assist you.
So there's a question here that says, can a child with CHIP or Child Health Plus through the marketplace get CFTSS services with CES care coordination? So just to clarify that these services are for children who are eligible for Medicaid, not children who are meeting the requirements for eligibility under the Child Health Plus program. The other piece to this is that CFTSS services are state plan services. They do not require the care coordination that the HCBS services do. The CFTS services are coordinated by the provider, and if you're in a plan, the plan can help with that as well for those services that came in January. As long as your child is not an SSI certified disabled individual, because those services are continued to be accessed through fee-for-service for the time being.
The question is, does crisis intervention have to be in the youth service plan, or can any enrollee or family of an enrollee call the crisis number? So for the purposes of this particular crisis intervention service, if a child is likely to need crisis intervention, the service can be placed on their plan of care. The number to that crisis provider can be part of the child's safety plan or crisis plan, and the care manager could notify the crisis provider that that their service is on the HCBS enrolled child's plan of care, and the number that the family should call in terms of at times of crisis should be on that safety plan. And yes, so if it's on the plan of care and the care manager has notified the crisis intervention provider, then if the child is in crisis, the family could call that number because it's on their plan of care and in their safety plan.
So there is another managed care question with regard to Medicaid managed care. Is that something we need to enroll in? Is that something similar to me choosing which health insurance plan at my job I have? Or who will not have to enroll in a managed care plan, and what will the exemptions be? At the time of the change for managed care, which is still, all of these changes are subject to CMS approval. So the CMS approval to enroll 1915C waiver children in managed care is not in place yet, so it's not happening quite yet. I just want to make that very clear. So currently, if a child is enrolled in a 1915C waiver, they may elect to choose a managed care plan, but they don't have to. Some children enrolled in waiver actually have comprehensive health insurance, that's private health insurance, in addition to their Medicaid. For those children who have this comprehensive health insurance coverage from a private health plan, you cannot enroll in a managed care plan. That group is excluded from enrolling in Medicaid managed care. So what that means for you is that even though in the future we might be saying children who in general are enrolled in a 1915C waiver have to enroll in a managed care plan, and it's time to pick a plan. And like Meredith had mentioned, you have 60 days to make that choice. It is, you have several plans in your county, most likely, that you will have an opportunity to choose from. You will call New York Medicaid Choice, most likely, to make your selection. Your care manager can also assist with that. And then you would be enrolled in the plan going forward. However, if you have comprehensive health insurance, you continue to be excluded, because in this transition, the only pieces that we're changing to whether or not you have to choose a plan is this one piece about the 1915C waiver, where if you were exempted from managed care only because you were participating in a 1915C waiver, that exemption's going away and you will have to pick a plan. But if you have some other thing on file that's leaving you in a place where you can't join a plan, like you also have Medicare or you have comprehensive health insurance, then your status is not going to change and you're not going to have to pick a plan. The other piece that's changing, which might affect some children, for some folks who are listening today, is that for children who are placed with a volunteer foster care agency, those children currently are not enrolled in plan, and at the time we do have approval to put populations into managed care, we will also be enrolling children placed with volunteer foster care agencies. But, none of the other exemptions or exclusions are changing. And as we said, if you have questions about what your particular exemption or exclusion status is, please call New York Medicaid Choice at the number we provided. They can help walk you through what your particular situation is.
So someone is asking if you could just explain what Medicaid managed care is. So I think maybe some folks don't just basically understand that.
So we sort of had a slide on it maybe. Yeah. So Medicaid managed care, right now, the way the state provides Medicaid services, we have our traditional regular Medicaid service where providers sign up and they say, I will take Medicaid patients, and they see a patient and the provider directly bills the state in order to get paid for that service. And every time the provider provides a service, they bill the state for that service, and that's how they get paid. That is called regular Medicaid or Medicaid fee-for-service. The state also contracts with, I think we're at 19 different plans, what we call, they're all health maintenance organizations, they're all HMOs, and we contract with those plans to offer the Medicaid benefit to their enrollees. So we say to the health insurance company, please cover our Medicaid recipients as you do, other people who have health insurance, and the benefit package that you give them is the same as the benefit package that individual gets from the state if they were in regular Medicaid. So for most individuals on Medicaid in the state today, if you are getting Medicaid services, you are most likely enrolled in a Medicaid managed care plan. There's about 5 million people enrolled in Medicaid managed care plans, and that's how they get their Medicaid services. There are a few services, like we've been talking today, that the managed care plans do not cover, and those individuals would continue to get them through the fee-for-service system. But most of the Medicaid services are already in the managed care plan benefit package, and so that the individuals who are enrolled in plans just get everything covered by their plan. And that means you get a plan ID card, you go to providers who work with the plan. The providers then, instead of billing the state for the services you get, they bill the health insurance company for those services. I hope that's helpful.
That was helpful to me. So there is a question here, what happens to a youth after the age of 21? So as I was mentioning that it's a care manager or with the CES or your providers, around the age of 17, 18, we should be working with you and your family about the adult system, and depending, again, based on your child's need and as they approach age 21, looking at the types of services in the adult system that would best meet their needs. So really every plan for every child would be individualized in particular. And as I mentioned, there are comparable adult services like HCBS services, and also in the OPWDD system or in managed long-term care. So it really would depend on the services. So if you're young adult, child should be having those discussions, you can approach your care manager and other service providers to start talking about those potential adult services. And then there's a question about, are our care coordinators being given all this information? So as you can imagine from just this webinar alone, there's a lot of information and changes happening. So We've been working with providers for many months now to assist them. There's lots of resources, webinars, trainings that we have provided to them. If you feel like you're not getting the information that you need, then I would recommend that you call the agency that your care manager works at or your provider works at. You could also call your health home to get assistance. Both of the health home and your care management agency should have a 1-800 number that can assist you, and you also can feel free to call the Department of Health, the health home program, or as we listed as a resource, the managed care complaint email, as well as the 1-800 number. So there's a number of resources to address your questions or needs that you may have. And again, we are continuously working with our providers and care managers to make sure that consumers are getting the information. If you're a little more savvy, we do have a consumer information web page that has lots of documents and tip sheets. OMH also has that available. All the brochures and other things that Meredith addressed will be there as well. So there are resources for you. So I hope that you work with your care management agency and then also have these other resources available to you. So there's a number of questions regarding private duty nursing, and I just want to be clear that private duty nursing is a state plan services that is not part of this transition. So I know that there are a number of families that have the care at home waiver that is transitioning, and they may also have private duty nursing. So I just want to be clear that that service is not part of this transition. So if you have private duty nursing today, you should be able to continue with that. There should be no changes to any of the processes or the nursing that you are acquiring, even though your child may also be in the waiver services. There's also a number of questions that are asking about the availability of providers. Some of the questions are specific to private duty nursing, but also to respite providers, or I saw another service here.
Palliative care.
Palliative care. So now that we're combining these waiver services together, and there may potentially be additional children that want to access those services, we are working with communities and providers to see what the needs are and how many families, and see how we can address if there is a potential shortage in providers. We obviously are working with the current providers that were providing these types of services and have designated them. So our goal is to ensure that we understand what the need is based on location, county, and then address those type of issues if you are finding that there's not the right types of providers or enough services in your area. We will be addressing those. And then someone asked a question regarding that in managed care. So one of the benefits, I think, of working with managed care is they can also assist with developing providers to meet their recipients' needs. So as we move some of these services under Medicaid managed care, as Hope eloquently explained to us, then we will all be working together to make sure that any children and families out there that may feel like there's a shortage of providers or services, that we are developing providers in your community to meet your needs. So
one of the questions is, Are the current children in the OCFS, Bridges to Health DD waiver, able to transition to health home, or do we need to be referred to the care coordination organization? And also, what about the B2H medically fragile children? Can they transition to health home as well? So again, all three Bridges to Health waivers through the Office of Children and Family Services, that includes the serious emotional disturbance, developmental disabilities, and medically fragile waivers, all will be part of this transition and conversion, and all of them will be going to the Children's Health Home. So all of the waiver care management under B2H is converting to the Health Home program and will be a part of the Children's Health Home Care Management program. So they do not have to go to CCO. That's a different waiver for different children. All the children will be in Health Home.
So there's a question, are foster care populations still going to stay under regular Medicaid, or will they be moving to managed care plans?
Well, I believe I mentioned earlier that, well, let's break it down a little bit. Upstate, there are children who are considered, well, all foster care children are in the care of the local social service district, but there are certain, in upstate, there are certain children who are in direct care of the local district. Those children are already enrolled in managed care plans, unless for some reason their needs cannot be met through that enrollment. What we have also, though, are some children who are placed with volunteer foster care agencies. Those children are not enrolled in managed care today. In the future, those children will be enrolled in volunteer foster, the children who are placed in volunteer foster care agencies will be enrolled in Medicaid managed care. There was another managed care question about still around the comprehensive medical insurance, and I just want to be clear that if you have comprehensive health insurance today and you also have Medicaid as your secondary insurance, that status does not have to change. You know, you don't have to drop your, in most cases, you wouldn't have to drop your commercial coverage to maintain your waiver services. You would just stay in the group of individuals who are receiving their services, including their waiver services, through the fee-for-service program, and you would not have to enroll in a Medicaid managed care plan. There's nothing in this transition that is requiring you to change your commercial coverage at this point in time. The other question here says, what is the reasoning behind exempting children who have secondary comprehensive medical insurance? And mostly that has to do with the variety of comprehensive commercial coverage that is available, and how you administratively figure out what is left for a managed care plan to cover. And to this point, since the program, the current mandatory program began in 1997, the individuals with comprehensive health insurance have not yet been carved into managed care, but you know, there are things that the state is constantly looking at, and whether or not that could change in the future is something we might be working toward. But for now, there are no plans as part of this transition to change that exclusion.
So there was a question, a great question. Who is the first point of contact for someone who needs to initially apply for HCBS? So that's a great question. So the answer is it depends on the child's Medicaid status. So if the child does not have Medicaid, the way that a family would get HCBS, or to see if they are eligible for HCBS, would be to contact what's known as CS, again, the New York State Children and Youth Evaluation Service, and they would assist the family in determining if the child met HCBS eligibility. And if the child was eligible for Medicaid, CES would work with the family on the Medicaid application and help them get access to HCBS services. If the child is eligible for Medicaid and enrolled in Medicaid, the child or family can refer themselves to a health home, a health home care management agency who serves children, and identify themselves as needing home and community-based services. And the health home care manager would help families to determine if they met HCBS eligibility and be able to work with them through that process. Obviously, in addition, if there are children who are working with their local counties, whether it be the local districts of social services or the local departments of health or the local departments of mental health and their single point of access, you can always ask your county if you have any questions or need any assistance, and they can also assist you.
So there's a question, does the youth sign off on their service goals since they sign off on their plan of care that the care manager develops? When we're working with families, we want to have a person-centered plan of care where, you know, you as the child in the family get to determine your goals. And if the child's age appropriate, can understand what's on their plan of care and is part of that process, then we absolutely would ask them to sign their plan of care and be part of the whole entire process. So just like they may do today, they would continue to do that moving forward with their service plan with their specific HCBS providers, as well as with their plan of care with their health home care manager.
So there's a question on respite and how it can be billed. So you can bill it in 15-minute increments up to 4 hours, and then anything after 4 hours is going to be a per diem.
So we just got another batch of questions in, so if you could just give us 1 minute to look at those.
So there is a question about how soon can you access palliative care services. So all the services that we showed today for HCBS will be available on 4/1. So that would include palliative care, so April 1st of this year.
So there's also a question about regarding housing and vehicle modification grants, and how does that happen? What if we use some grants previously? What are the caps? So we are just trying to streamline the process. So right now, today, you work with your local departments of social services, and you probably also work with your providers or your care manager. So those processes will still be in place. We are, as I said, mentioning how to streamline those. So the first thing I would say is if you feel like your child would benefit from a modification of your home or your vehicle, is to talk to your care manager or to CES. Their care manager or CES needs to do, I will say, work with you and evaluate whether that is a need, and then that needs to be part of your plan of care. And then that plan of care and a referral goes to your local district of social services. And then your local district of social services needs to have a contract with a community provider who will then either come out to your home to assess what the need is. So kind of like a contractor to come out and see what the need is and then develop a contract on how they will do the modification. And all the approvals go through the local departments of social services. There is a limit of $15,000, and if you need to go over that limit, then that approval needs to come to the state at the Department of Health. So just because there is a limit doesn't mean that you can't go over it. It just needs a prior approval to do that, depending on what the job or the modification is. If you had previously used a modification, then you'll share that information with your care manager, and it really would depend on when that modification was, like how long ago it was, how much it cost at that time. So it's difficult to say whether or not there would be some restrictions or not. So I think the best step to take is to talk to your care manager, talk about your history with a previous modification if they're unaware of that, and then they can start the process to move forward from there. So we're just making sure that we've covered all of the questions. We have a number of duplicates about managed care, so we just want to make sure we're not missing anything.
We would also say that if you did not hear your question answered today, we do record all the questions that came back through the chat, and when we are posting the webinar today, we will also be posting Q&A from the webinar. And your question will be there, or you're invited to call or contact one of the resources, either your care manager or the resources that are included in this slide deck to get further information.
Okay. And with that, I'd like to thank everyone for participating in today's webinar. We're really glad that you joined us. Obviously, if you have any outstanding questions, we welcome those, and I'd like to thank all of the state agency representatives who have shared their time with us this evening to answer your questions. The slides and recording from this webinar will be posted on MCTAC's website, and also there'll be a link from the Department of Health's website as well. If you have any difficulty locating those, please feel free to email us, and we'll send you the link once they're posted. Thank you very much.